Cathy Salem. I'm a radiation oncologist with Shady Grove Adventist Hospital. The U.S. Preventive Services Task Force have come out with a statement based on statistical studies telling us that mammogram for women between the ages of 40 and 49 is not useful in terms of lives saved, and they are not recommending that study for those women. For women between the ages of 50 and 74, they recommend that the study be done every other year. And they have recommended that physicians not bother teaching their patients self-breast examination anymore, based on the fact that they can't prove that the self-breast exam saves women's lives. There are a couple of things we should keep in mind, and the task force actually made this clear. They recommended that women think about this on their own, that this is a personal decision and should be based on their preference as to when they should begin obtaining screening mammograms, and that women should discuss this with their own physician and come to that determination. The risks that they're concerned about are not risks based on danger from the study physically. They weren't worried about the amount of radiation a woman gets from a mammogram. What they were worried about was the possibility of a finding that turns out to be benign on biopsy, and the worry that a woman goes through in the interim waiting for that. I think most women, and actually studies have shown this, would rather know for sure and go through a few weeks of worry rather than put their head in the sand and hope everything turns out okay. These guidelines that the task force issued do not apply to women who are at high risk for breast cancer, who carry the BRCA gene, or who have a strong family history of breast, ovarian, or colon cancer. These guidelines do not apply to women who have had previous abnormalities on mammogram or MRI screening and are being followed. The American Cancer Society has specifically come out with a statement saying that, hey, we're standing by our guidelines. We want women at the age of 40 to begin annual screening mammography, and we are not changing our recommendations based on this study. As well, the Health and Human Services Secretary, Cathy Salem, has come out and issued a statement saying, we're not changing what we're doing right now. The federal government is not issuing new guidelines, and we are not changing what we would pay for in terms of screening mammography through the government. And I think that's a pretty strong statement, indicating that women should go ahead with routine screening. One additional consideration that women should weigh in with in terms of their decision whether or not to go ahead with screening mammography is their preference for treatment. We know that if women are diagnosed later rather than earlier, the chances are that the tumor will be larger. And if you have a larger tumor, you have a smaller chance of saving your breast. If you are inclined to have a lumpectomy and radiation therapy rather than a mastectomy, then you don't want to forego your screening mammography. So my recommendation to all women is to stick to the current procedure, continue checking your own breasts, period.